Good evening, dear friends. We are going to see the muscles of the chest. Before going to see this video, please like, comment, subscribe, and share. You can see the bell icon on there. You just tap it so that you can receive the notifications whenever I post a video. Thank you. Let's get started. So the first and foremost muscle which we are going to discuss is nothing but the pectoralis major, which is arising from the anterior surface of medial two-thirds of the clavicle. Then the sternocostal fibers arising from the sternum and the ribs, and the lower fibers which are coming from the external oblique abdominis aponeurosis. So from these three different areas, pectoralis major is arising and it is getting inserted to lateral lip of intertubercular surface. In this picture, you are going to see the pectoralis major muscle fibers which are coming from the ribs and the lower fibers which are coming from external oblique abdominis aponeurosis. Below the pectoralis major, you can identify the triangular shaped muscle called as pectoralis minor, which is arising from the third rib, fourth rib, and the fifth rib. And this pectoralis minor, which is getting inserted to the coracoid process of scapula. This is the pectoralis minor. And what are the both actions of this pectoralis major and minor? So adduction of the shoulder joint will happen by the action of this pectoralis major and minor. This is another exercise to improve the chest muscles pectoralis major and the pectoralis minor. Another one is bench press. You can perform the bench press in order to improve your pectoralis major and the pectoralis minor. And this fibers. So this is an exercise which we can improve the middle fibers, sternocostal fibers can be improved by this exercise. And this exercise helps to improve the clavicular fibers of pectoralis major or upper fibers of pectoralis major. The lower fibers of pectoralis major, there is abdominal fibers, external oblique abdominis aponeurosis, which is giving origin to the lower fibers of pectoralis major, that will be improved by this exercise. Now, underneath the pectoralis major, lower part it is occupied by the pectoralis minor. Then just below the clavicle, we can identify the subclavius muscle, which is arising from first costochondral junction, and it is getting inserted to the subclavian groove, which is present at the inferior surface of medial two-thirds of the clavicle, and it is supplied by nerve to subclavius. And the pectoralis minor is supplied by the medial and lateral pectoral nerves. Even pectoralis major is also supplied by medial and lateral pectoral nerves. And here you can identify the subclavius muscle. And last muscle is nothing but the boxing muscle. It's also called as serratus anterior. So the serratus anterior, which is arising from the upper 8 ribs, and the fibers are which are extending posteriorly, transversely they are present. They're extending posteriorly and they're getting inserted to the medial border of the anterior surface or costal surface of the scapula for insertion. And it is supplied by the long thoracic nerve, which is coming from C5, C6, and C7. And action of this is boxing. So it is also called as boxing muscle because it protracts the scapula. So serratus anterior, which is pulling the scapula on the ribs. So during the boxing movement, during the punching movement, the scapula will protract on the ribs. So that's why this muscle is called as boxing muscle. Thank you, dear students. See you soon with a new class.